हमारी आज की प्रेजेंटेशन का टॉपिक है टाइप्स ऑफ डिसइंफेक्टेंट्स एंड स्टरलाइजेशन। यानी हमारे पास डिसइंफेक्टेंट्स कौन कौन से हैं जो आम रोज़मर्रा की ज़िंदगी में हम हॉस्पिटल्स के अंदर इस्तेमाल कर सकते हैं, और जो चीज़ें स्टरलाइज बिटवीन पेशेंट होने वाली हैं वो कौन कौन से तरीक़ाकार हैं कि हम किस तरह से अपनी चीज़ों को या आइटम्स को स्टरलाइज कर सकते हैं। इसके लिए the important thing is you should know what kind of disinfectant you are going to use, where you will use this disinfectant, when you are going to dilute the disinfectant, is it open air or is there any ventilation? Then dilution, disinfectants dilute. We must know the contact time, stability, after preparation, कितनी देर तक ये जो डिसइंफेक्टेंट हमने बनाया है वो कितनी देर तक स्टेबल है। स्टेबिलिटी से मतलब है कि हम कितनी देर तक इसको इस्तेमाल कर सकते हैं, या कितने दिन तक या कितने घंटे हम इसको इस्तेमाल कर सकते हैं, क्योंकि कुछ डिसइंफेक्टेंट्स जो हैं वो हम 24 आवर्स की डाइल्यूशन के बाद इस्तेमाल नहीं कर सकते। कुछ डिसइंफेक्टेंट्स हैं जो हम 5 to 7 डेज तक हम इस्तेमाल कर सकते हैं। हम जब कोई भी सोल्यूशन प्रिपेयर करते हैं उसके लिए ज़रूरी है जो आपका कंटेनर है वो विद लिड हो, उसके ऊपर ढकना हो, आई मीन टू से, और फिर उसके ऊपर लेबल हो, किस तारीख को, किस दिन, किस डेट पे, किस टाइम पे आपने ये सोल्यूशन प्रिपेयर किया है, और उसकी ड्यू डेट भी उसके ऊपर ज़रूर लिखें ताकि आपके बाद आने वाला जो भी वर्कर है वो अंडरस्टैंड करे कि ये सोल्यूशन की स्टेबिलिटी कितने दिन तक है और कब तक ये ख़त्म हो जाएगी। डिसइंफेक्टेंट्स जो मोस्ट कॉमन हम ऑर्गेनाइजेशंस में या हेल्थ केयर सेटिंग्स में या क्लिनिक्स में या नर्सिंग होम्स में हम इस्तेमाल करते हैं उनमें सबसे पहले है अल्कोहल, फिर क्लोरीन है और क्लोरीन कंपाउंड्स हैं, हाइड्रोजन पेरोक्साइड है, पैरासिटिक एसिड है, और पैरासिटिक एसिड एंड हाइड्रोजन पेरोक्साइड है। The first disinfectant is alcohol. Alcohol refers to two water-soluble chemical compounds, ethyl alcohol and isopropyl alcohol. These alcohols are rapidly bactericidal rather than bacteriostatic against vegetative worms, bacteria. They also are tuberculocidal, fungicidal and virucidal, but do not destroy bacterial spores. So that is the reason in first lecture we said that because alcohol is the disinfectant and other disinfectants also cannot kill the bacterial spores. The optimum bactericidal concentration is 60% to 90% solution in water. The second disinfectant is chlorine. Chlorine we can found in different type. Like we are using chlorine to disinfect our water, drinking water also. Most of the time people they are using in water tanks also, but in hospital environment we are using to kill the bacteria and other infections, and we are using this one chlorine we are used to use to clean patients' rooms, beds and other hard surfaces. They have a broad spectrum of antimicrobial activity, do not leave toxic residues and unaffected by water hardness, and inexpensive and fast active. Remove dried or fixed organisms and biofilms from surfaces and have a low incidence of serious toxicity. So chlorine, whenever we will dilute, we must know that it must cover with the lid. If we are going to keep chlorine solution for 24 hours, so we must cover and label this one. The spot disinfection of countertops and floors. We should know how to dilute, what is the dilution, how much water and how much bleach we can use. For this one in detail we can read the CDC guideline, but the common dilution is 1:10, means you will take 1% chlorine and 9% water. The third disinfectant is hydrogen peroxide. This is cleared liquid chemical, sterilants and high-level disinfectant containing hydrogen peroxide and their cleared contact condition, and it disinfects. It works by producing destructive hydroxyl free radicals that can attack membrane lipid, DNA and other essential cell component. Hydrogen peroxide is active against a wide range of microorganisms including bacteria, yeast, fungi, viruses and spores. Peracetic acid. Peracetic acid is characterized by rapid action against all microorganisms. Special advantages of peracetic acid are that it lacks harmful decomposition product like acetic acid, water, oxygen and hydrogen peroxide, enhance removal of organic material and leave no residues. It remains effective in the presence of organic matter and is sporicidal even at low temperature. Type of sterilization. So we will talk about type of sterilization. हमारे पास कितनी किस्म की स्टरलाइजेशन है और हम इंस्ट्रूमेंट को स्पेशली सर्जिकल इंस्ट्रूमेंट्स जो हैं उनको हम किस तरह से क्लीन, डिसइंफेक्ट और स्टरलाइज कर सकते हैं. सो वी हैव अ स्टीम स्टरलाइजेशन जिसको हम ऑटोक्लेविंग कहते हैं, और गैस प्लाज्मा स्टरलाइजेशन जिसको हम हाइड्रोजन पेरोक्साइड बेस्ड स्टरलाइजेशन कहते हैं. Sterilization destroy all microorganisms including bacteria. Sterilization should be used for instruments and other items that come in direct contact with the bloodstream or normal sterile tissues. It need high pressure, require time contact and maintain temperature. Steam sterilization. High pressure steam sterilization is an effective method of sterilization. Temperature should be according to the sterilizer or equipments. Allow all items to dry before removing them from the sterilizer. Do not overload the sterilizer. Between the items and walls of sterilizer, overloading alters heat convection and increase the time required to sterilize. Steam sterilization requires 4 conditions: adequate contact, sufficient high temperature, correct time and sufficient moisture. Decontamination, clean and dry. All instruments and other items prior to sterilization, they must be clean and decontaminated. So all these procedures can be done in the central sterilization department. All joint instruments should be in the open or unlocked position. Like joint instruments, we can say like a forceps, artery forceps, needle holder, or mean to say that any instrument that have a tooth, it must be open, it should not be hinged. Instruments should not be held tightly together by rubber band or any other means that will prevent steam contact with all surfaces. So the important thing in sterilization is this, that we must clean first instruments, disinfect, keep them dry, pack them properly, keep instruments open so the steam will pass through all the instruments and the sterilization can be maintained. The second type of sterilization is gas plasma sterilization. Gas plasma sterilization, or we can say hydrogen peroxide based. This method can sterile items less than 1 hour and has no harm by products. It does not penetrate, however, and cannot be used on paper or linen. Specialized sterilizer is required for performing gas plasma sterilization. Shelf life. This is very important that we should know the shelf life of instruments after sterilization. The shelf life of an item how long items can be considered sterile. The item remains sterile until something caused the package or container to become contaminated, teared, package become wet, or anything else that will enable microorganisms to enter the package or container. So we must know before using any packing or any instrument or any other equipment which are sterilized, and you are going to use this one, so you have to monitor the package. If its seal is open or teared, we should not use that sets. We have to send back these items to CSST for re-sterilization. So these are the surgical instruments that coming and going in the sterilizer. So the trays must be managed very well. It must be, before we take it out, it must be dry, and we should not wipe after the sterilization, or we should not clean instrument before use after sterilization. These are some references. We can see in detail how we can clean, disinfect and sterilize, and what kind of materials or disinfectant we can use for the items using between patients. So we can understand by this presentation that any item we are cleaning between patient needs to be disinfected, but the prior disinfection needs to clean. And then this is important to know the date and time of dilution of the used disinfectant, whatever we are going to prepare, and what is their stability, and on which item we can use the high level disinfectant, low level disinfectant, and what kind of instruments or items are that we have to sterilize or we are going to use between patients. So I hope you understand all the presentation. Thank you so much.